My name is Mary. I'm a final year medical student at Glasgow University, and I'm also a very proud member of Medact Scotland. I'm here today to facilitate this session along with Rob from Medact. I just thought I'd give a bit of background as to what Medact do, who Medact are. Medact are a public health campaigning organisation, and we wish to challenge the social, the political and the economic factors which contribute to poor health and deepen health inequalities. So Medact do that via lots of different streams, but primarily they really want to enable their members to take practical action on all issues, and that could be running campaigns or publishing reports, but they also provide a space where we can discuss ideas like this tonight and encourage each other to make real change in our fields of work. So today we're going to be talking about the Green New Deal. I appreciate this can sometimes be quite a big sort of conceptual idea to get your head around. So we're really hoping that by the end of the evening, you'll have a really firm understanding of what the Green New Deal actually is, and specifically what role healthcare workers can play in championing a Green New Deal that has public health at the heart of its focus. And I think that it's important to note that as we move to this post-COVID recovery phase and we start talking about the future and climate change dialogues become really prominent in the mainstream media, I think it's really important that we begin to talk about climate change in a way that goes beyond just climate science, and actually we start talking about issues of justice, and that could be economic justice, social justice, all these kind of things. And I think that that concept of intersectionality is really what the Green New Deal highlights, the importance of bringing all these different streams of thought into our discussions about climate change. So I'm going to introduce our first speaker. Our first speaker is Guppi Bola. Guppi was the former director of Medact, so I really hope I've done your work justice, Guppi. She's a researcher and a public health strategist with a background in economic justice campaigning. So today Guppi will be talking to us about her recent report, Rethinking Public Health, and she will also be exploring how the Green New Deal can address health inequalities. So Guppi, it's over to you.
Hi, sorry. I was grinning slightly at the beginning of your introduction because I don't have a tendency to simplify complex ideas. I have a tendency to want to bring clarity to them. So I think that's what I'm going to do. So, I'll maybe introduce the Green New Deal a little bit from my perspective, but I'm actually going to throw quite a lot of information in your direction, and probably push you quite a lot to the edges of what you believe and understand to be climate action in the context of climate justice work. So, okay, let's begin. Yeah, so as Mary said, I'm going to be speaking a bit to the work that I've done with Commonwealth, and actually the report which got released last week is about 15 years of thinking put into 20 pages. So it's really like not a document that offers answers. It's a provocation and an invitation to engage in a theory of change that thinks about public health and demands us to think about public health and practice it in the context of the crises that we're living in at the moment. So when the Green New Deal started gaining space last year in the kind of political spectrum, I was really dismayed at how little attention was being put towards the role of public health within that. Because public health taught me how to care about the climate crisis, you know, it spoke to the growing health inequalities that are related directly to changing weather impacts. And public health taught me about economic justice, in particular how patterns of ill health and disease are reflected in where wealth exists and how it's extracted from communities. And public health taught me about intersectionality by introducing me to the complexity of a person's lived experience and how those experiences are shaped by the intersections of systems of oppression and discrimination. So it felt in all of the conversation around the Green New Deal that public health was really fundamental, and yes, it was really missing. So what I'm going to try and do is speak a little about what the Green New Deal means to me, and the work that I think that we need to do, how public health needs to be transformed, what kind of frameworks can lead us to action, and how you can engage in this work. And simply, I'm going to try and introduce you to the idea of how racial justice strategies can intersect with climate justice strategies. In a workshop that I normally take about 4 hours to deliver, I'm going to try and do it in about 10 minutes. Yeah, and really how the relationship between these strategies connects at the site of our body through our health and the health of our communities. So maybe some of you will have heard that the Green New Deal is ultimately a public investment program that supports tackling the climate crisis at the same time as addressing inequality. And they do this by finding ways in which we can shrink the dominance of the fossil fuel industry through things like subsidies and taxation, and working out how we can invest in green technologies to bring about more jobs in the low carbon green sector. And if we were to design Green New Deal policies with these existing mainstream thinking around climate and inequality, I think it might create a nice package of policies that could get some political traction and some political buy-in. But the version of the Green New Deal, that version of the Green New Deal does not much for me in terms of inspiring me into action, because what it looks like in what I've seen at the moment is, cycle lanes and car-free hospitals. And this report is not about cycle lanes and car-free hospitals, as nice as they are. This report is much more uncomfortable because it also has to speak to the experience of discrimination and the way in which we are not going to get very far if we don't look at that within the policies of the Green New Deal. So yeah, the report is entitled Rethinking Public Health, because in order to do this work, public health practice and professionals really need to step up. And one thing I think we forget too often is that health inequalities are avoidable and unfair. And I remember rereading this over and over again and just reminding myself they're unfair and avoidable. And with this increasing divide between the most deprived and the least deprived, it suggests that something very active is happening in the system to create that health gap. And too often we look at those impacted by health inequalities or the most deprived with a form of passivity or a sort of sense of paternalism, which prevents us from really addressing the root causes of ill health. And so in order to do this better, we definitely need a better analysis of the system that we're living in. So my thoughts started racing maybe about a year ago when I read a report or one study in East London in which the variants of impacts of air pollution were measured in residents of Newham based on their racialized identities. And it told us that we already know about, it told us something that we already know about social determinants of health, but I missed my, it told us what we already know of social determinants of health, but so often ignore, which is that the incidence of asthma was higher in people of colour, not because they lived closer to the road or did less exercise or had less access to income or poor housing conditions compared to white people. Because when all of those were controlled, it actually suggested that the experience of discrimination was the connecting factor between them having an increased incidence of asthma. And you'll say that you can't conclude much from one study, and I completely agree. But we've spent too far and too long fumbling around finding other factors or other reasons why this discrimination can't be the only thing that's at play. And of course, it's not the only thing at play, but we ignore it so much and don't even bring it into the epidemiological data and analysis in the way that it should be invested in terms of understanding people's lived experience. And because we've shied away from naming discrimination and how it operates, we've just kind of left the door open for people's experience of health inequalities to be interpreted in many different ways, in ways that are often full of prejudice and very damaging. So we've sometimes had Tory ministers suggesting that residents who live underneath airports made the choice to live there so that they should just deal with the consequences of air pollution and onset of asthma, or that the compounding factors of obesity, levels of physical activity or food consumption were lifestyle choices and things that people had to find the agency themselves to deal with. And sometimes when I think that we're advocating for things like warm homes and greener spaces, these are nice, like I mentioned, but at the scale of what is actually happening to individuals and communities and has been happening for decades, if not centuries, it isn't really representative of the policy response that we need in order to address health inequalities as they present today. So I focus much more in the paper on the experience of inequality because of the issues prompting many to advocate for the Green New Deal are reflections of a broader health crisis. And to give you a better picture of the kind of the active systems at play, which I want us to really understand. Also, sorry, can I have a time check whenever I'm 5 minutes towards the end? That would be really great. I want to read an extract from an interview with a trans activist called Nim Routh, who, if you don't know, I'll drop their Twitter handle at the bottom later, because they describe this so much better than I could. So there are real parallels in the way that humans extract from the planet and create borders and police populations in the service of profit, and the way that humans extract what they need from the bodies of people and create borders between our bodies and control us in the service of profit. Many of the ways we understand the category and categorize people in modern world were constructed explicitly by Northern Europeans in order to justify their project of global dominance and wealth accumulation, i.e. colonialism, via industrial capitalism in the 19th century. They needed a workforce to deliver that expansion and extraction from the planet. And there were certain types of bodies that were deemed useful and not useful in that conquest. The colonizers assigned value to different human life to morally justify to themselves the degradation and dehumanization of different peoples in pursuit of personal wealth. A key function of that dehumanization was to reduce people to bodies and to reduce bodies to a vessel of labor or a tool of production. Black bodies were enslaved to provide free or forced labor to expand and extract resources for Europe, while disabled people were deemed unfit as they couldn't produce labor and were not needed in the industrial workforce. And LGBTQ people were deemed immoral because they weren't able to reproduce the workforce that was needed for industrial expansion. So as a result, those definitions, we sort of exist in a system in which discrimination operates in service of the economy that is built and has entrenched many ideas around many groups of people that we as public health have replicated in the way we speak about marginalized communities, the way we research marginalized communities, and therefore the way we attend to policies that are meant to address marginalized communities' lived experience. And importantly, we will not do justice to health inequalities solely from the perspective of just looking at wealth and income data that has some correlation to people's health inequalities. And the WHO's conceptual framework of social determinants of health asks us to inquire how macroeconomic and social policies shape an individual or community's social economic position. This should be done also by interrogating how each person benefits or struggles from systems of power that make up the economic system, first by naming them, and then by using health data to explain how they operate. Like every human experience, data needs to be sophisticated and complex in describing the associated experience of discrimination, marginalization, and oppression. Can I just check how much time I have before I go on?
I think you have a few more minutes. I think that's fine.
What's few? It's very subjective.
4 minutes.
Fine. Okay, we can do this. So if we can understand the depths to which the extractive economy is impacting our health, we will have a much more strategic position. We'll be in a much more strategic position to do something about it. But we also need public health professionals, health activists, medical health professionals, to be better at speaking to one earth we are trying to build as an alternative to the extractive economy. So there's a lot of work to do on actually understanding what's going on, but there's a whole other lot of work to do in even speaking to a vision of what we're trying to build. And it strikes me that I hear very few health professionals, very few people in the health community talk about a health-centered economy when it seems fundamental that that is what we are trying to create. But to do this, we don't need to start from scratch. So don't worry if it feels like something that you're far away from. Instead, we can look to the historic work that marginalized communities have been doing by learning from their experience of health and placing that in the broader strategy that adopts the principles of reimagining public health. And I'm not going to go into it now, but in the report, there are some case studies of some excellent communities who have basically used their experience of interrogating why they're existing with ill health to look at the structural sort of systems around them and collectively organizing to do something about it. And I so encourage you to just read those case studies. But there's been so little attention paid to it because the capacity for our mainstream movement to design visionary policies is so limited. Those designs have come from a position of privilege, and that experience of whiteness, middle classness, able-bodiedness, straightness It's just nowhere near the full experience of those at the sharp end of inequality. And we know who is at the sharp end of inequality because of the names and faces of those that have died from, for example, COVID-19 and many other crises that have come before it and will come afterwards. There's an activist from the US called Marie Brown, who's amazing, who writes, "Imagination is one of the spoils of colonialism and colonization, which in many ways is claiming who gets to imagine the future for a given geography. Losing our imagination is a symptom of trauma. Reclaiming the right to dream and strengthening the muscles to imagine together as Black people is a revolutionary decolonizing activity." So for this paper, I didn't just sit in my room and pontificate on what it could be like to build a Green New Deal that is centered on sort of intersectional and intergenerational and international principles. I looked at the communities who have been doing that work for many years. So I looked at the knowledge and expertise of Indigenous communities, migrant communities, the queer liberation movement, disability justice activists, and those committed to Black liberation. And that is where I started from, and that is where I invite you to begin. I'm going to end quickly by just saying, we have clear evidence the past decade has been lost in health improvement because of austerity, in which the social infrastructures that we'd relied on for so long have been dismantled. So in the UK, we're doing incredibly badly. You know, a working class woman from the north has worse health outcomes today than she did 10 years ago. We're also in the middle of a pandemic in which the government is severely mismanaging, in which many, many people are dying, but which is also presenting who is dying first, and we need to really pay attention to what that means. And we're at the precipice of climate, like really incredible climate breakdown, which we as the UK are historically responsible for. So if this is not our time, I just do not know what is. Like, we are being called to act now, and I just really encourage everyone. I know you're gonna be like, what do I do, which is great, and I'm like, look forward to the Q&As, but we just really need to organize. Thanks.
Thank you so much, Guppi. Just to say on a personal level, like, I found your work and the report so incredibly inspiring. And to everyone watching right now, if you have like a spare, I don't know however long in the next few days to read the report, I really recommend you make that the next report you read, because it's truly an incredible piece of work. I've put a link to it on the Commonwealth website in the chat now. Just to introduce myself, my name is Rob. I'm the Climate and Health Organizer at Medact. And I'm really excited to be introducing to you our next speaker, Dr. Abdul. So just to introduce him very quickly, Dr. Abdul is a physician, epidemiologist, public health expert, and progressive activist. He was previously the health director of the city of Detroit and a professor in the Department of Epidemiology at Columbia University. In his work, he's recently made the case for why we should think the Green New Deal as a new deal for public health. And today he's joining us all the way, correct me if I'm wrong, Abdul, you're joining us from Michigan in the United States.
Right.
Over to you, Abdul.
Yeah, thank you so much. First, I have to say that it's a privilege to catch up with my old classmate, Guppi, who was my classmate in Oxford when I lived in your beautiful country for a couple of years while I was doing a master's and then a DPhil. And the fascinating thing is the best part I always think about growing up, quote unquote, is watching your friends grow up. So it's been a privilege watching you work and reading your work. And I hope that all of you are so privileged to have awesome folks with whom you get to grow up. So if the gray hair, if there's a silver lining aside from in your head, it's the watching folks getting older. So I really appreciate the opportunity to be with you. The beautiful thing about webinar is that you get to cast into evening time in the UK. It's still, as you can see, middle of the day here in Michigan. I'm an accidental environmentalist, and let me explain why. When I was in the UK, actually, one of my best friends on the scholarship that took me to England was an environmental economist. And at that time, I was studying public health, and I sat down with him one day, and he said, Abdul, you should really pay a lot more attention to the environment. And I asked him why. Because for me, the environment was always polar bears and Icelandic fjords. I still don't know what a fjord is, but people trying to explain to me why I should care about fjords and polar bears. And for me, the question I kept asking is, look, my grandmother, she was the wisest, most intelligent person I've ever met in my life. And she grew up in Egypt, where she got married when she was 15 and had 8 kids, 2 of whom died before the age of 1. The infant mortality rate in my grandmother's family was 25%. Tell me why I should care about polar bears when babies still die. Because the fact of the matter is, every summer when I'd go visit my grandmother, I'd travel about 15 hours and 10 years difference in life expectancy. But I didn't have to go that far. If I were to drive from where I am sitting right now into any neighborhood in the city of Detroit, I'd be driving 10 years difference in life expectancy. Babies die at that rate in high income countries all the time. We just choose not to pay attention to it because, of course, we've been tricked by averages to believe the net equities are okay. And so sitting across from my friend, I said, I don't know why I should care about these things when, in fact, babies are dying. Tell me how they affect babies. And he said, they are one and the same. And I hope that someday you figure that out. Fast forward about 7 years, and I am taking a role as health director in the city of Detroit. My job was to rebuild a health department that had been shut down when the city was facing bankruptcy and state takeover of its finances. They made a decision to shut down a 185-year-old health department in a city with a higher infant mortality rate than my father's native Egypt. And I already told you what the statistic meant for my family. They shut down a department in a community where our children face 3-fold the probability of being hospitalized by asthma, 4-fold the probability of being exposed with lead, shut down a 185-year-old health department. And in my work, we were really focused on the challenges that transmitted intergenerational poverty. We wanted to leverage health to disrupt intergenerational poverty. And the goal there was really brought on by the fact that for the first 3 weeks of my job, I had no clue what I was doing until I got educated by a 3-year-old little boy. And he was the 4th child of a 21-year-old mom, met his father probably 4 times in his life because his dad is the victim of mass incarceration. This kid was not your average kid. Most of the time when you meet a 3-year-old, I'm sure all of you have had this experience, they don't like walk up to you and shake your hand, give you a big hug and, go about their day. They look at you, realize they don't know who you are, and then bury their face in their parents. This kid didn't do that. Gave me a big hug, shook my hand, had a whole conversation with me. And I'm sitting here thinking that this boy's natural confidence is being fundamentally undercut by the circumstances of his life. And our job is about making sure that he has the opportunity to learn and earn in a community like Detroit, like we would want for any child anywhere. And so we set about trying to think about the health outcomes that mattered most to disrupting intergenerational poverty. One of those outcomes was asthma. And I already gave you the asthma hospitalization differences, 3-fold the probability of being hospitalized with asthma if you live across the city line versus just north in Oakland County where I grew up. And we got to thinking about what the causes were. And when we started mapping asthma hospitalization incidents as well as lung cancer incidents, we found that the worst place to be in Michigan was this zip code called 48217. And 48217 happens to be the home of a constellation of different corporations, all of which pollute extensively. And because in our country, we've gutted the infrastructure to regulating corporate polluters, and we're on the precipice, unfortunately, of cutting the legislation as well, these folks were being bombarded by all kinds of regulated pollutants. And the worst of them was sulfur dioxide. And the worst of the worst was a petroleum refinery owned by Marathon Petroleum. And Marathon, in my second year at the job, wanted to raise its emissions of sulfur dioxide when the EPA, the federal agency overseeing environmental protection, already had deemed 48217 as being in what's called non-attainment, meaning there was too much sulfur dioxide in the air as it was. And here we are, this corporation is trying to increase its emissions. And that was the moment that everything my friend had said had clicked. Because oftentimes when we think about climate change and our responsibility to it, it is easy to make the problem feel so abstract, like it's some stuff in some air that has some impact on some temperature over a long period of time. But what we tend to ignore is that all of those pollutants that drive that climate change come from somewhere. And the people who live next to the airport, or the people who live next to the petroleum refinery, these are the folks who suffer it worst. Because as those pollutants go up and destroy our atmosphere, they're being sieved through the lungs of children like this little boy. And on its way up, it causes threefold the asthma hospitalization rate, 1.5 times the probability of cancer mortality. And our responsibility is to take that on. That was the moment that I became an environmentalist. I want to speak specifically to the Green New Deal for a second. I happened to run in the same election cycle as Alexandria Ocasio-Cortez, who everybody now knows as AOC. And I remember when this idea had sort of come up. And when I think about public policy, the question I always ask is, what does it mean for that little boy? And I want you to think about what the Green New Deal is. It is an interlocking system of solutions to an interlocking system of problems. We know we have a climate change crisis that is barreling down on us, and we have to solve it. But we also know that we have hundreds of thousands, now millions of people who are structurally cut out of the economy. And we know that both your country and mine, that our infrastructure is failing. It has been failing for a long time because we have stopped investing in public goods. So the question of the Green New Deal is a pretty simple one. How do we put millions of people to work building out green tech and infrastructure to address our climate crisis? That's the question here. And then I think about that little boy, and I think about his circumstances. It's not just that he has to breathe the air coming out of the tailpipes of trucks idling in his community, or of the smokestack in that Marathon Petroleum Refinery. It's also that boy's dad, even before he became a victim of mass incarceration, his probability of being out of work in the city of Detroit was upwards of 20%. Now, after COVID-19, it's even higher. And then I think about the fact that in Detroit, we undid our light rail system because, of course, Detroit is the city that put the country and the world on wheels, right? Ford and Chrysler and General Motors are headquartered not too far from where I am right now. And so to show the world how the car was going to fundamentally change American life, what did they do? They undid their mass transit system. Now we have a system of buses that come every hour if you're lucky. And so I think about that boy's life and about what a Green New Deal would mean for him, about his ability to breathe easy in the community in which he was born and raised, about his ability to know that his parents have high quality jobs that pay a living wage, that come with benefits, his ability to move around the community that he lives in. To me, that is a clear win. And the implications around addressing his health go well beyond simply the pathologies that we pay attention to under the skin, but also seek to address the social pathologies that create inequities that tend to fall on kids like him too early and throughout their lives. And so to me, this is an obvious approach. And I think that any of us who believe in the public's health, who neglect the responsibility that we have to thinking about the health of the globe, which is the single place, as far as we know, unless Elon Musk's got something going on we don't know about, is a single place where all humans have to live, then I think it behooves us to act. And I'm really grateful for your leadership and your activism in taking this on and in recognizing these connections. And I really appreciate you having me today.
Thank you so much, Abdul. I think I can speak for all of us when I say that was extremely inspirational, and it's really interesting to hear your story on the journey to becoming a climate activist and, you know, embracing the Green New Deal. And wish you all the best. I know that you have to go around what I think is 3 o'clock your time, so just to mention, don't worry about that. That's all right. Thank you so much for joining us this evening. I'm going to introduce our third and final speaker for the evening before we go to Q&As. So it's my pleasure to introduce to you Dr. Stephanie Davis Le Brun. So Dr. Stephanie Davis Le Brun is a clinical psychologist working in older adult mental health services and is a member of the Northwest branch of Psychologists for Social Change. She has recently contributed to an open letter calling for a just recovery to COVID-19. When researching human rights in acute mental health wards, she started exploring how the physical environment can impact on psychological well-being, and has since become more interested in the idea of psychologically healthy community spaces. So without further ado, I'll hand over to Stephanie.
Thank you very much. I'm going to just
attempt to share my screen because I do have some slides. So we'll see if this works. Let's have a look. Hopefully that's worked for people, and people can see it okay. It's mainly just to not be able to have to see my face as I talk, to be honest. But yeah, thank you for that introduction, Rob. Like I say, I'm a member of Northwest Psychologists for Social Change, and recently we've been campaigning for a just recovery to COVID-19. So I thought I would kind of start first of all with giving it just a bit of an introduction about Psychologists for Social Change for those that have not heard of us before. So we're a network of psychologists, kind of applied psychologists in any background profession, who are interested in applying psychology to policy and political action. We believe that people's social, political and material context are central to their experiences as individuals, and we really would love to encourage more psychologists to draw on our shared experience and knowledge to engage in public and policy debates. So kind of really get involved in those in politics basically, as well as our day jobs. Projects have included, I've just put a little note there, briefing paper on the impact of austerity, psychological impact assessment of universal basic income, education, kind of recent briefing paper on racism is not entertainment, lots of kind of projects on the ground as well within communities. I've put the impact of austerity near the beginning because in that paper we draw on the 5 key indicators of what a psychologically healthy society would look like, and I'm going to come back to those kind of later in the presentation. I think it's been really great to kind of hear both Guppi and Abdul's presentations today, because I think it's going to fit quite nicely with what I speak about, because I guess I'm speaking about from a position of being a clinical psychologist working in the NHS as a health professional. So I'm going to be talking a little bit more about those kind of things that we can do on the ground, but I think throughout that it's going to be really helpful to keep everything that Guppi and Abdul have talked about in mind as well. So this was just kind of a little introduction to what we've been campaigning for recently. So in Liverpool and Manchester, we have metro mayors. I don't know if people have come across that before, kind of meaning that we have devolved powers to make decisions on kind of housing, transport, skills, business, that kind of thing. And the mayors in the Northwest, Liverpool and Manchester, have expressed a commitment to Build Back Better campaign, which is great. So I'm going to keep optimistic about it and say that it's it's a welcome commitment. And obviously we just kind of wanted to express our views on what we feel a just recovery after COVID-19 would look like. I guess when we started this campaign, we kind of called it Just Recovery. We talk about Build Back Better, but actually I think Green New Deal fits very nicely with all those concepts as well. And that is something that as PSC as an organisation we are interested in. So kind of a contribution to that commitment that the mayors have made, we kind of talked about points around homelessness. In the Northwest we have increasing and huge amounts of homelessness and food poverty as well. Massive numbers of people relying on food banks, relying on universal credit, very high numbers of unemployment. Things like that. And it's not a very good advert for the Northwest, but there are great things as well. But we, kind of some of the highest rates of long-term physical health conditions, highest amount of diagnosis of anxiety, depression, things like that. So obviously these are all things that we wanted to comment about as part of this wider commitment, because obviously there is a lot of talk about environmentally friendly cities and the impact of this on well-being, but kind of the theme of this has been that actually sometimes it is greater than putting in a park in the city, or insulating homes. There's a lot more to it than that. And I think we've been really just trying to emphasize that what we would really need for kind of just recovery to COVID-19 is equality for everyone.
So just a bit of background to that. So obviously we're here to talk about the Green New Deal. So just in terms of linking this to well-being, and I guess well-being can include psychological and physical well-being. We've heard a lot about the Green New Deal today, kind of advocating for social and economic equality, creating new secure jobs, economy that serves everyone, protection of our climate, and promoting global justice as well. So this is where I really wanted to link in those 5 indicators of a psychologically healthy society that Psychologists for Social Change have developed in the austerity briefing paper. So the first indicator, we talk about agency, so the kind of feeling like you have control to make your own decisions in life. And I think just thinking about kind of that link to the Green New Deal and thinking about young people are now reporting that the most important issue facing the world right now is climate change, but yet they don't have any control in it. A lot of them not old enough to vote, you know, kind of very much feeling the responsibility of something that has been caused by our generation and generations before us, that they're actually going to have to deal with, and not having a sense of agency within that. So kind of that comes into equality as well, and that we need to get everyone involved in this. We need to have everyone in society feeling like they have control over what their future is going to look like. Thinking about security, it's important for societies to be psychologically healthy, that people feel they have a sense of security. You know, we kind of currently live in houses that aren't very ecologically friendly. We have flats and apartment buildings that are unsafe due to cheap materials. And I think, you know, when I think about that, I think about Grenfell Tower, and kind of work in buildings that don't offer anything towards our well-being. And of course, there's many people without any secure housing at all. And I think everyone should have the right to feel safe and secure with a home. And also, I think our kind of infrastructure, our spaces should give back to the environment, and kind of give back to us as well in terms of improving physical and psychological health outcomes. You know, I think it's already been talked about today that we kind of have design that doesn't really benefit anyone at the moment. So yeah. Thinking about connection, kind of connection, feeling connected to society, feeling connected to others, obviously to maintain psychological healthiness. Like I say, that infrastructure can help us feel more connected to others. Our cities and the way we work actually encourage sedentary lifestyles. You know, we kind of get in the car to go to work, we sit on a bus, we sit on a train, we sit in an office all day, every day. We need radical new design within our cities and spaces, which we already know it's already proven that this results in better health outcomes. And we also need that design to help foster a sense of community, kind of more shared spaces that we can use together. Thinking about meaning as well, this is another key indicator. So kind of just having a sense of purpose in life. For example, we know that people can get a sense of purpose through their job, through creativity, through spirituality. We know that people are more likely to be happy in their job and feel more productive when they believe it has a sense of purpose. And I guess it's a bit of a cheesy point, but you know, what better purpose is there to work towards saving the planet? And obviously, this is what we kind of need to be thinking more about in terms of the climate crisis that we're in at the moment. And then the 5th key indicator that we outlined was trust. And I think, again, it's been kind of talked about today, is that trust in the government currently is reduced. There are a lot of concerns around misinformation. And, you know, you often hear now that we live in a post-truth society. We do need strong government accountability, and we do need more diversity between in those decision-making processes. You know, I think we're at a point now where we have so many people doing so many fantastic things on the ground, so many charities, networks. You know, we need to be hearing their voices more, and help people to feel empowered in the decisions. And also kind of on an individual level, we need to foster a sense of trust within communities through shared values, so that we can all kind of enjoy living in a psychologically healthy society. And I've just put at the bottom there that policies that encompass these values can help to bring a truly equal society. And I've kind of highlighted truly there because, you know, we have equality laws, equality and diversity laws, we have human rights laws, but actually the UK is still one of the most unequal societies in the world. And, you know, where's accountability there? And we do have these laws in place. So yeah. So I'm going to only skip through this because I think it's been talked about quite a lot already, but kind of what an equal society can do for us. It can benefit everyone in society. It doesn't make one group worse off and one group better off. It makes everyone better off. And I think, you know, it's an important point to think about that the current economic system that we have has actually reached a ceiling effect. It's not making anyone better off anymore. We've reached a point where we're seeing a turn now, and it's a downturn. So for example, there are people who are going to be born kind of in the next decade or so whose life expectancy will be less than ours. So it's, you know, the structure that we have at the moment just isn't working for us, and it's time to rethink it. It's time to think how to do things differently. And I just put a few points there about kind of equal societies and how they can improve outcomes in kind of many different ways. So, very important point. What can we as health professionals offer? Because I think sometimes, you know, I've been on webinars before where I've just felt inspired by them but completely overwhelmed at the same time, and I think it can feel overwhelming. So kind of just a few points on what we can offer on the ground. I think inequality shows itself most clearly in health and social care settings. Therefore, we do see how it impacts on people. We have that in-depth knowledge of what equality does for people. And I think we really do need to share these stories more loudly and more often. You know, we have the huge privilege in being able to gain all of this rich information and hear lots of people's different stories, just from going to work every day. We see society through everyone's eyes, and I think we should use this knowledge that we have. I also think we have a professional duty to follow the evidence base, and we cannot pick and choose which evidence base we follow. I thought that was quite a frank point, but I actually feel like Guppi has been quite frank today as well, so it's okay. I'm going to go with it. You know, what I mean by we cannot pick and choose which evidence base to follow, I'm going to give quite a psychological example because that's probably what I know best, but I'm just thinking about, you know, someone that comes to see us who might have a diagnosis of depression. Our evidence currently tells us that if someone has a diagnosis of mild to moderate depression, to give them a course of cognitive behavioural therapy. So we sit down with them, we assess them, we think about what's going to be best, we formulate, and actually what we find is that this person recently has become unemployed. They recently have tried to apply for universal credit, but they got knocked back. So they have no money for food, they have no money for bills. And here we are trying to get them to change how they think about their situation. Well, actually, we have a massive evidence base that tells us that poverty and austerity due to government policies can cause psychological distress. So why is it that we choose to follow one evidence base and not the other? And it feels like we now need to be shifting really towards that wider systemic evidence base. Also, services are becoming more and more stretched. You know, like I say, I work in the NHS and just kind of growing waiting lists constantly. You know, at what point do we start demanding redesign of services? It's quite clear that how we work now is not working in anyone's favour. You know, I think part of it is about investment and finance, but I don't think it's all about funding. I think we live in a very individualistic society, and I think our healthcare services focus on treating individuals and individual problems. And I think the Green New Deal moves us more to a collectivist position. I think where we can redesign services that kind of take these wider issues into account, and can think about health outcomes in a different way rather than locating it as a problem within that person. So I think we need to be shouting a little bit more about that, which leads me on to the next point of using our voice. We need to have confidence and feel empowered to research, to write, to speak, and we need to get more involved with service decision making, organisational policy decision making. Being a clinical psychologist in particular, it's a very powerful and privileged position, and there's no point having it unless you can use it for good. And I think it's really important that we try and use what we know and our expertise for meaningful change. And as Guppi said, now is the time to do this. We're in a COVID-19 pandemic crisis. It's not the only crisis. We're in a diversity crisis. We've got a climate crisis going on. But I think we've seen recently how people have been really valuing healthcare and social care professionals. We've been a little bit more listened to than we perhaps have been recently. Scientists have been at those daily briefings, they've been involved. And actually it just feels like now is the time to move with that motivation and to move with those kind of positive views on healthcare professionals at the moment, and to try and make some meaningful change, really. So I think that's everything from me. Yeah, that's my call to action, but I will leave that in case I get that asked that later. Thank you.
Thank you so much. That was interesting. I really liked your sort of psychological approach to adjust recovery. I'd never really considered that when I think about the Green New Deal, but I found that really interesting. So we're going to move on now to the Q&A session. If you wish to ask a question, at the bottom of your screen there should be a little Q&A button which you can click and type in any questions. We've actually got two questions already for the panelists, so I'll start with the first one, which is from Honey Smith, and it's about echo chambers. So I'll offer this up to all the panelists, and anyone who feels obliged can take it. The Green New Deal is obviously born out of quite left-wing politics, and Honey's wondering how we can engage right-wing governments in this discussion.
I don't mind taking this because I read this and I thought it was a interesting question. So I think we should work out whether, look, we're going to have Boris for the next 4 years, and there's many reasons to why there are kind of very authoritarian forms of government with Trump and everything else that's going on. Work out what we are actually able to do in the timeline that we have at the moment, or possibility of different form of government. A right-wing government is not going to implement the Green New Deal, and we've seen that because of the way that it's been interpreted in the New Deal version that Boris has displayed recently. I think one of the reasons why I struggle to understand why we haven't moved on to the conversation or use the concept of health more, and I feel like this has changed since COVID, but really valuing health more, and speaking as health professionals to engage people in that conversation, engage people in their experience of feeling like they have a lack of power and a lack of control over their lived experience and how that is impacting their health, is because I think that transcends political identities. So if thinking about building power beyond what's happening at a governmental level, that can put us in a really good position for opportunities that might come up at when elections emerge. But also it's really important to, I think the Green New Deal is very lefty. And I think one of the things I write in the paper is that, there's one thing around state intervention and state policies that are really important to take responsibility for things like tax redistribution and reparations and things that only can happen at a state level, but realistically the things that need to happen in terms of ownership and democratic economics have to happen at community level, and we do have the capacity to do that. The powers at a local authority level are much stronger. We see this in many northern towns, like in Preston and in the southwest, where local authorities and leadership within local authorities, that includes directors of public health, recognise that there are powers that they can do to redistribute the money that they have been using for previous service provision into something that is much more long-term and sustainable. So we should be doing that a lot more and working out ways in which we can do that. And I think we need to make a difference between people who are driving, so like wealthy people who are on the right, who are driving the narratives that we have to adopt and absorb, and who are actively working against the idea of the Green New Deal, to those who are impacted by those narratives, and like finding ways in which we can build relationships with them around those common themes of people's health experience, so that we can work together in the future on it. But I think that there are ways in which the Green New Deal doesn't need to be referred to as a Green New Deal, but also can be something that people can find attractive and want to buy into beyond, beyond it being kind of like a leftist progressive agenda.
I'll just jump in and say that, politics, oftentimes folks sort of think of as being this force that just exists, that just happens upon you. And obviously I'm a lot less aware of and appreciative of the dynamics of British politics versus American politics. But my sense is that, don't assent to it. Choose to get involved. Choose to vote your folks out. I mean, I think a lot of times when we think about activism, we sort of give up on the political sphere when, we have one of the greatest tools at our disposal, which is democracy. And democracy doesn't just mean speaking truth to power. It means becoming power. It means changing the people who represent you. And I think the nice thing about your constituencies is that they're small. You think about an American district is 800,000 people. A district in the UK is 80,000 people. And the ability to push an 80,000 person district in a certain direction is pretty big, especially given the fact that like the role that money plays in your politics, thankfully, is far smaller than the role that money plays in ours. I ran for governor, which is, a state of 10 million people, and I raised $5.5 million and got outspent 6 to 1, right? $5.5 million bucks, had to raise it. You think about the amount of money spent in a constituency for an MP position. And then folks will say, well, the parties control a lot of that. All right, well, then infiltrate the party. How do you make sure that folks who represent your goals are being reflected in labor or in whatever other party that you choose to be a part of? And so my sense is just that, like, there is a lot to change. And yes, you're stuck with Boris for 4 years. How do you make sure that 4 years from now that you can move the thing forward? And the last thing I'll say is that the way that that politicians tend to think about these issues is in terms of the kind of vote cost it's going to create. And the more you can create movement on the ground and movement in the media and a narrative around these things, you can push folks. And oftentimes, like I think about like the world under Trump for the last 3.5 years, and part of me is just like, yo, you all have Boris. But there is a way, I think, to force them to pay attention to the changing tide, and to change a conversation around them, particularly your local MPs. The nice thing about a parliamentary democracy is that, your MPs are connected to the executive. Whereas for us, Congress can do and say whatever it wants to do and say, doesn't change anything on the executive side of the field. So just some reflections. But with that, I'm going to have to roll. I really appreciate your work and your activism and your leadership, and hope that we get to connect again soon, maybe across the pond. Maybe y'all come here. We have a lot of work to do here too. So really appreciate your time. Thank you.
Bye.
Thank you, Dr. Abdul. Goodbye. We have another question. This is from LJ. This is a question asking, there's often a gap between what we know works and what's actually happening in real life. How do you find the energy to keep on fighting? I think that's meant to be a bit less morbid than it sounds, but I guess what LJ is asking is, how do you keep up that momentum when it can be very exasperating to see the reality before us?
Stephanie, I think you should take that one.
Yeah. Gosh, yeah. To be honest, I think, sometimes it can feel demoralizing. Sometimes it can feel like it's difficult. You you can feel a little bit downtrodden sometimes. I think it's almost a little bit connected to the last point, in that you need to find your allies. It's important to, you know, get a group together so you don't just feel like it's just you out on your own all the time. And it's really about trying to build up from the bottom, a bottom-up approach rather than a top-down approach, because I think when you're building up from the bottom, you get more small wins that kind of encourage more and more motivation, and it does encourage you to kind of keep on going. Yeah, I think, like I say, it's finding your allies, finding a network of people, and I think that's really important as well. Kind of network of people. There are always other people out there that kind of work alongside your values, that are standing up for the same thing you are. You know, kind of I'm part of PSC, but you know, we have close links with Medact. There are always other people there, so it's always really useful to pool resources as well. So it's kind of not all down to you. So yeah, kind of find your allies, go for those small wins that can encourage that motivation, and kind of reach out to others as well.
I definitely, yeah, I think that's, I was going to say that one of the things I wanted to add to this was, you know, for me, it's like learning more about what is going on gives me much more foundation to be able to manage where to go. So the more I read about, and you know, I take it from my experience of being a person of color, so like reading more about the history of racism and how it exists and how it perpetuates itself, and the kind of experiences people have, and being able to see myself in that, and then also be able to understand others as a result of that, means that I feel more like I can situate myself in the world, but I can also spend time visioning what needs to happen. And I think that's really important to give you some, because I think everything feels very unstable at the moment. And if you don't, and the whole thing about truth and what is truth, like to find that in other people and to learn from other people as well is really, like, for me, feeds into me a lot. And I think that there's, and I was saying that because Psychologists for Social Change work, the actual framework that Stephanie brought up earlier was actually going to make it into the paper, and then it didn't somehow. But it was also really good for me to kind of speak to what I sort of read as a form of self-determination. You know, like you would want those 5 elements to self-determine. So finding things like that speak to your experience, and then speaking out loudly what your vision is. Like, I genuinely believe that we can manifest change by actually just saying what it is that we want to happen. I'm like working very hard on this project that I dreamt about, where Oxford University were going to undertake a process of reparations by giving land to its long-standing migrant communities, and I was involved in that process, and I just really want that to happen. I both live in, or have family in Oxford, and also studied in Oxford, so I have a very like strong tie to that city. But I keep feeling like if I say it more often, then something will happen in the future very soon, because someone will hear it and it will happen. And the last thing is that we have to remember, this has happened with Black Lives Matter recently, and it's happened, you know, it happened with XR, it happened with many big movement moments, is that there is this, like, we have to remember the cycles of the way that movements work, and that you get a real big escalation and you get sort of a slowing down. But the slowing down isn't a slowing down, it's us settling into the process of organizing and learning and connecting. And I think that we in the moments that movements feel silent, actually, like, a lot of the really hard work is happening, and a lot of the really good work is happening. And I think we get a lot of energy from seeing like outward activism, and that's very classical climate activism, is like, you know, I guess marches and like direct action events. But the kind of deeper community level work that needs to happen around climate activism is something that we don't speak to enough, and we don't actually invest in enough. And those relationships are what will help you keep going in the kind of like peaks and troughs of the movement.
Thank you to both of you. That was some great answers and lots of food for thought. I think this whole idea of grassroots activism and communities is really important when we're addressing the climate change agenda. We've got 2 more questions. The first one is asking, how can we be inclusive in bringing all people's perspectives into the Green New Deal conversation, especially those experiencing adverse conditions who perhaps don't share the same priorities as a lot of climate activists?
Yeah, I think that's a really important point, because I think there's always going to be a population out there who struggle to get their voice heard, who, I think we were talking about kind of trying to find that truly diverse voice, that so that everyone feels like they're empowered to make decisions and have a voice in those decisions. But yeah, there's always going to be people in society who feel like they can't, and I think sometimes it can be really hard to find those people as well. And I think, you know, I'm just thinking about a project that we did with Psychologists for Social Change, where one of our members in London, you know, she went and just sat in communities where there are a lot of young people who, there's a lot of kind of high violent crime. It was a very, you know, it took a lot of her time, and it was a very brave act, but just spending time with people in those communities and really listening and really hearing them. And then I guess when I was saying, you know, we have a lot of power, we're in these privileged positions, we can then kind of listen, hear that, and take that voice. But I guess it's we need to be really careful that we do that in a way that's kind of respectful and not tokenistic as well. Yeah. I don't know if I've explained myself very well. Guppi might have more to add to that.
I mean, this is a lifetime work, just to give you some offer some to enter it with patience, like it's lifetime work. And I do think that community organisers, activists have to walk this fine balance between accountability and building relationships, and what can into like tokenism and extraction of relationships. So really understanding what it means to kind of like seek people's participation in the work that you want to do in order to make it accountable, but also offer it integrity and to learn from those relationships, but to do it in a way that actually centers others first, and centers their priorities first before entering into yours. And I think one of the best ways in which you can build a really regenerative learning process with each other is to go to others by telling them or showing them the work that you've done already on trying to understand their experience, and asking their permission as to whether, you know, you can engage in a conversation with them about how you could do better, and then showing up for them before asking them to show up for you. And I think that they're kind of like good processes to do. I also think, I mean, so for someone who is like highly privileged but also lives with experiences of marginalization and oppression, the thing that I always come back to also is citation is feminist practice. And what I struggle with a lot, and that's quote is by Sarah Ahmed, which is like important for me to say as I say this, because acknowledging the work that grassroots communities and marginalized communities do and have been doing for decades is really, really important. I think I write about this a little bit in the paper, that a lot of the ideas that are like new and are going to help us get out of this crisis are indigenous practices or practices from migrant communities, and they're not new ideas. So uncover them and respect them and uphold them and give them platform, but also give the kind of make sure that those communities are at the center of that, and that we do the acknowledgement of the work that has gone before us, which is really, really important.
Thank you both. I've never actually heard that phrase tokenistic before, but I really like it. Kind of highlights that really difficult balance to amplify voices but not make tokens of them. We've got one final question which we can hopefully answer quite quickly. This is more about taking practical action. It's asking about the role that politics plays with healthcare workers. And there's clearly a good reason for healthcare workers to get involved with politics. They're respected and they have quite a lot of social capital. But how do we use our voices to speak up for a Green New Deal whilst maintaining the trust of our patients or people who might disagree with us?
I think that's an interesting point. And I think I'm a bit torn with this, because I think when you're kind of trying to pitch an argument for something that feels so radical, you are always going to come up against conflict, and it's about managing that conflict in the best way, in a way that you can keep integrity and you can keep relationships with people and trust with people. I think I want to say that kind of the work that I do on a day-to-day is very connected with the work that I do with Psychologists for Social Change, but there's also a bit of a gap between them, in that it's kind of my individual work and my kind of professional work as a clinical psychologist. It's very much informed by the person that's in front of me. You know, if they're kind of saying, I don't believe that I should be having this because of all these wider issues, I'm going to go with that. You know, I'm not going to press my views on people that are coming to me for kind of support, care and treatment. But at the same time, I guess it's thinking about that evidence base, isn't it? And thinking that actually we do need to be quite radical. We do need radical change. And it's just, I guess, just keep voicing about the benefits that it could make for everyone. You know, it's just keep going with that message that you are going to come up with conflict, and that sometimes that can be uncomfortable, but it's kind of managing that uncertainty. We talk a lot in psychology about having to manage uncertainty and manage kind of tolerate feelings of being uncomfortable. But yeah, I don't know if that's really answering the question, to be honest, because I guess because I've not been in a personal position where what I do kind of with Psychologists for Social Change has impacted on the kind of individual client work that I do. Yeah, sorry, I don't feel like I've answered that well at all.
Do I have time to add a little bit? Cool. I mean, I think that is a challenge. I think one of the ways that we can get caught up in feeling like we're unable to do that is by thinking about it on a one-to-one basis, but like we are so strong when we are collectively organized. And I think that the recent actions, like I have a union mindset in my head because I'm thinking about the way the BMA operated during the COVID pandemic and how they pushed for the government to really pay attention to the number of deaths, both within BAME staff members, but also the BAME community more broadly. And, you know, whilst it took a lot for that to happen and for that to be paid attention to, there was this, it wasn't just the health professionals, so like having the relationships with think tanks like Runnymede, with 2 or 3 really kind of like fast-paced journalists, with a bunch of community organizations such as Ebola, with other sort of high-standing health professionals and some royal colleges, you know, like map out your ecosystem and work out who is going to stand alongside you and speak with you so that you're not the only person saying it. And I think the more that you collectively say things that feel radical but are actually so common sense, it will come across that way, because it is really common sense what we need to do. And I think that kind of approach can be taken with individuals as well, you know, when you're depending how you're engaging with people, or if you're in the media, to just speak to the fears that you have of the way that the structures are designed at the moment, that keep perpetuating health, that we have in ill health, that we have data for to show, and that we need some kind of fundamental, quite radical shifts in the way things are operating in order for that to, you know, not be the case, and for you to not mop up the crap at the end of the day from a system that no one has power over at the moment. And I think that's really, really important.
Thank you, Guppi and Steph. We are going to, I think that's a close on our Q&A session. You please feel free to send more questions into the chat, and we can answer them by email if you prefer. I think I'll hand over to Rob now to bring this event to a close.
Thank you so much. That was such a powerful point to end on as well. I'm just going to sort of very quickly wrap up. I just want to thank you all so much for joining us this evening, and thank you to our amazing and inspiring speakers for giving us the energy we need to go out there and win a Green New Deal with justice and global health at its core. Before we close, I just want to say that we can't emphasize enough the challenges of the coming weeks, months and years. With the fallout of the COVID-19 pandemic only just beginning to reveal itself, and the failure of our leaders to address climate injustice, the need for an empowered and principled movement for public health is needed now more than ever. We can't wait for those at the top to do the right thing. We need to make change happen around us in our communities, whether it's creating good, well-paid green jobs, fighting for accessible infrastructure, or tackling racial and social injustice. Wherever it may be found, there's power to be harnessed at a local and regional level to bring about a healthy society built on social well-being instead of profit. In the coming month, Medact is going to be launching our Health for a Green New Deal campaign guide to help spark action locally for a green and just recovery. Alongside this, we'll be looking to run sessions with groups across the country aimed at building your Health and Green New Deal campaigns locally. If you've been interested in setting up a campaign session with us, a link should be appearing in the chat box around about now. If you click on it, it'll take you to a form. If you fill that in, we'll be in touch. But that's pretty much us for this evening. Thank you so much for joining us, and I hope you all have a really nice rest of your evening.